Hi, everyone. I'll give it maybe 30 more seconds to let a couple other attendees join, and we'll get started. All right. Hello, all. Welcome to the Moving Minds Alliance Research Forum, webinar number 2. Before I hand over to our co-chair, Joan Lombardi, I wanted to just provide some information on housekeeping. We have Arabic and English interpretation. So if you need to access interpretation, please click on the interpretation button. I wanted to mention that the language of the presentations will be in English. So if you if you are an English speaker, you can either use the original audio or English. You can use the Q&A tab to ask questions to the presenters, and we'll use the chat tab to interact with other attendees and for troubleshooting. And I'm going to pass over to Joan Lombardi, the co-chair of the Moving Minds Alliance Research Forum.
And thanks so much, Kate, and welcome everyone from all around the world. We are thrilled to be again hosting a webinar on behalf of the steering committee and my co-chair, Erin Merriam. I want to welcome everyone. It is my pleasure to introduce today's moderator. Dr. Ghassan Issa is a Lebanese community pediatrician, a graduate of American University of Beirut Medical Center. He has been the general coordinator of the Arab Network for Early Childhood since 2012 and is the co-founder and general coordinator of the Arab Resource Collective. Among many other positions, Dr. Ghassan is a member of the Early Childhood Development Action Network Executive Leadership Board and Steering Committee, as well as a board member of the International Developmental Pediatric Association. More than anything, he is a long time and well-respected champion and a true friend of children and of all of us. It is an honor for you to be joining us today as our moderator, Dr. Ghassan. I'm thrilled you're here. Over to you.
Thank you so much, dear John, for this kind introduction, and many thanks to the Moving Mind Alliance Research Forum for these activities. I'm having trouble in sharing my screen. I'm sorry.
You can go ahead, Dr. Ghassan. I'll keep my slides up.
Okay, that's good. Now, what we have today are 3 things to present in this webinar. We have first to present presentation of a strategic research model that was developed by the Arab Network for Early Childhood, NECD, and will be presented by Grace Boutros. And second, a presentation by Ahlan Simpson Program and the New York University Global Ties and IRC Lebanon. And third, there will be the announcement of research fellowship finalists at the end, and then of course we'll have before that some time for questions and answers if you want, but you can always put your questions in the chat anytime. So let me start with presenting Grace. Anyhow, the presentation, the CVs of the presenters are very long and they are very active. So I'll try to do my best to give a good idea about these very esteemed presenters in a very short time. Grace is a Lebanese humanitarian and activist with a clinical psychology and project design and management background. She is the current regional programs coordinator and partnerships lead at the Arab Network for Early Childhood and the Arab Research Collective. She has accumulated more than 8 years of experience in the fields of community, mental health, parenting, ECD, mental health, and psychosocial support, and SGBV. He is an expert content developer and has extensive experience in project management, research, and psychological work with an emphasis in analytical professional practice. Over to you, Grace, please.
Thank you, Doctor. Can you see my screen?
Yes.
We can see yours.
Okay, thank you. Thank you, Kate. So I just wanted to mention that if anyone wants to ask any questions while I'm going, if you want to use English or Arabic language, you can use both languages and I will be able to answer in both. So thank you for having me here today. I will be talking, as Dr. Ghassan was saying, about the ECD research in Arab countries, the big gaps that we have and the solutions that at ANECD we are trying to do, specifically talking about our strategic research model. Very briefly, I wanted to mention, since we mentioned both ARC and ANECD. So ARC was created and founded in 1989, and the purpose was to develop knowledge and develop human resources and do a lot of networking and advocacy in the topics of health, with an emphasis on mental health and ECD. And in 2012 and 14, there was a huge need to actually have an Arabic network for early childhood. So we created the Arab Network for Early Childhood in 2014 with a purpose to actually push and advocate more for the children that are living in these countries. So our work is mainly right now in 9 Arab countries. We have very active partners in Morocco, Tunisia, Egypt, Palestine, Lebanon, Jordan, Iraq, Yemen, and Oman. And it's good to actually have a look at what is the situation in these countries, because families and young children really need us and need every single one of us to talk more. And they're all going through poverty, displacement, refugees, insecurity. There's a lot of parental stress because they are parents, but there's also added stress because of the situation they are in. There's gender inequality. There's a health crisis in whatever country you go to, and the violence is socially accepted. So while we do share the common language and we do share all of these things, there are certain cultural nuances that are different. So here we ask the question, when we want to know more about the situation of these children and their families, where do we look for data? So usually we look for data in governments and academic institutions, but when you come to the Arab world, you will find that there is no available data. The data, if available, is incomplete, or it's outdated, or it is inaccurate, it is biased, or it's even inaccessible because it's not shared, especially when we want to do comparative study, or it's not holistic and comprehensive. And here we wanted to fill that gap. We wanted to try to respond to that, because without accurate data and evidence, we are not able to respond to the actual needs of these young children and their families. So ANECD's role is basically to start with the national. When we're talking about the national, we're talking about all the local actors, whether it is the local governments and the ministries, or we're talking about all the actors like academic institutions, the community-based organizations, even the activists themselves. And we want to bring all of them together on a national level and take all that work and experience to the regional level and then amplify it on the global level. So this is what we are trying to do. We're trying to intervene on these 3 levels. And the first thing we thought that is essential for us to do in order to have effective work and in order for us to have impactful work is to facilitate and support national ECD networks. So currently we have 2 up and very functional ECD networks, one in Jordan and one in Palestine. And in 2023, we are creating 4, we're facilitating 4 ECD national networks, one in Lebanon, one in Egypt, one in Tunisia, and one in Morocco. And the purpose is to bring all the key players in ECD on an intersectoral and multidisciplinary level together, so they can work together, coordinate together, and make sure that there is a strategy for ECD on the national level, highlighting all the priorities that are needed for us to respond to the essential needs of young children and their families. And with these established national ECD networks, all the work that we can do can be more impactful because it is coming from the national network, from the national and local actors themselves. So here it's worth talking about what are our strategic working areas, and we have 5. The first one is child rights, which has been our mission since we were created, and it is cross-cutting. The second one is ECD in emergencies, digital empowerment and distant interventions, environmental hazards and climate change, and the ECD workforce. And we work on them by 3 working approaches. The first one is knowledge production and promotion. The second one is partnership and advocacy. And the third one is policy intervention. And here we come to the strategic research model, which is a model of research that we created in 2021, and we have tested, and we have seen great results. So the purpose is to have a participatory research in all the Arab countries who we are active in. First, we choose a topic based on the priority areas that each local actor finds. Then we decide on the methodology that we're going to do in this research, and we develop the tools. Then we do the data collection in the best way possible for the methodology that we chose. Then we have the national and regional reports that will be developed. And then we develop policy briefs because we want our research to be impactful. We don't want to just have data, we want it to be an action research. And then we have the communication and advocacy campaigns and the advocacy and activities. So we have this 8 steps of work for the strategic research model that is essential to ensuring that we have a participatory and an effective evidence-based assessment research based on the need or the topic that we are choosing. So I want to talk to you about our first strategic research model, which we found was very successful. So the topic was the status of parents and caregivers during the crisis in 6 Arab countries, and we took COVID-19 pandemic as a model. So if you notice, we are taking each strategic intervention area from our strategy, the 5 I mentioned before, and we are trying to do the research based on these strategic intervention areas. So the first strategic research model was done in 6 Arab countries, in Jordan, Lebanon, Palestine, Egypt, Tunisia, and Morocco. And we definitely had different responses from different countries. But overall, we had 3,645 questionnaires that were filled by various caregivers. The largest participants were mothers, but we also had a lot of responses from fathers, which is something very interesting and one of our missions as well, to empower and engage fathers more. And we had a lot of relatives who were responding as well. And the study wanted to have a holistic overview about what are the needs of families and young children in crisis. And we took the pandemic as an example. So we tried to have all the different topics in mind. We covered nutrition in our questionnaire. We followed health. We followed the use of screens for entertainment and for learning from distance. We covered mental health of the children and the caregivers. We covered the challenges of parents in parenting, and of course, the family conditions. So there's these 2 types of challenges. We covered the access to educational services for children, the family support that they are receiving, and the ways that they were using to prevent the COVID virus. So we covered 11 themes in order to try to cover the most holistic approach when it comes to understanding their situations. And when we looked at the results, we of course had national reports that were produced, but we also had the regional report that was produced, and we found that there are a lot of commonalities. So one of the things that we found is that, for example, in Lebanon and in Jordan, the Syrian refugees were the most vulnerable and the most affected because they were getting the least support, and they were suffering from food insecurity. And then on the nutritional needs, we found that that was one of the priorities that all parents and caregivers were talking about. And then we had the second priority need was the health, and then the education. On the level of mental health, we did find many problems that children were facing, like the sleep problems, being irritable, involuntary urination, and parents as well as caregivers were reporting more mental health issues. One of the most common in all the Arab countries that were participating was being irritable. And on the educational level, we found that the early childhood education was hit in a major way, and that was due to, one, the lack of facilities and the activities that were happening, and also being ready. And with all this distance that was happening, there was a lack of enrollment later on in the rates of nurseries and kindergartens. So that was alarming as well. Children also did not have books, did not have safe spaces to play. They had lack of games and activities that were engaging and focused on their development. And we found that all parents mentioned that, like majority of parents indicated that there was a weakness in planning and readiness from the governments and from themselves when it came to this crisis. So all of these findings were very common and in all the Arab countries. And with that, we really thought, how can we replicate that, and what can we learn from this strategic research model? So we wanted to investigate more topics, and we are currently working on 4. The first one is the working conditions of early childhood educators in KGs and nurseries in 7 Arab countries, and we will soon have the reports. The second one is a review of child rights application in all the legislations and laws in 6 Arab countries. We also want to investigate the climate crisis and ECD in the Arab countries. And in the coming year, we will also investigate the professional development of the ECD educators in KGs and nurseries in 7 Arab countries. And because Lebanon was in a crisis, we did go over a holistic overview of the situation and even more in-depth overview affected by the multidimensional crisis. So this is a model that we found, and we are ready to replicate in other Arab countries. So why is this strategic research model beneficial? Because of many things. One, it is collective and it is participatory. It allows all the local actors to participate, to say what they think is beneficial and is priority for their countries. Second, it is mobilizing and it creates ownership for them. So that makes it more impactful when we come to the policy briefs and the action. The third one is creating quick real-time regional data. So with this method, it was very effective, very fast, and very cheap as well. And it is very replicable as a model. So all these 7 and 8 steps that I was talking about, you can replicate them in all the strategic intervention areas. It's also effective and successful when it comes to the implementation, the way we were doing it. And on the coordination, we learned a lot about that. And the last and most important thing is that it is an action research. It is focused on advising, programming, and it is policy oriented. It wants to make impact. We don't just want the data, we want to use all this collective and ownership and data to actually create impact. And how do we continue with that? There are many things we want to do. So we want to go back to our strategy, to our strategic intervention areas. And with that, we want to first increase the countries who are participating in the strategic research models. We are currently active in 6 or 7 countries. The other ones are have some challenges, but we want to reach them even more. We want to delve deeper in each of these topics because there are so many things to yet understand and learn about young children and their families. It also allows us to do a longitudinal research, and that allows us to do comparative studies. And we want to also do fellowship and capacity building for junior researchers who are very important, and who I see some of them are in the participants list today. And how we want to implement that is one of the big activities that we are also currently doing, which is our ANECD Regional ECD Research Committee. We are creating a research committee of multi-sectoral and multidisciplinary researchers in the Arab world. We actually have the launch workshop in May, in the end of this month in Amman. And with that research committee, we want to connect ECD researchers in all the Arab countries. We want to support more Arabic ECD knowledge production and dissemination. We want to advocate for these research, propose them, and fundraise them as well. We want to enrich the ECD database, which we also have on our website. We want to coordinate and organize various research activities, and we want to reach different communities and conduct studies in various contexts in order to have a bigger and more holistic view of the situation of young children and their families. So this is it for me. I am ready to hear any questions. I will be sharing the link to the Strategic Research Model 1 in the chat. And thank you.
Thank you. Thank you, Grace, very much. And where is the other? We need the other screen.
I see some a question.
Yes, I am sharing.
Yes. Okay. Do you want us to?
Should we take some questions now or leave the whole thing to the end? John, what do you think?
I think we can take a few questions now.
Okay, I have one question in the chat from, let me just make sure, where is she? Yeah, okay. From Lucy Bassett. How do communities help inform research topics? What approach do you use to hear their ideas and decide among them? This is one. The other is, how do you organize or manage these whole activities among the six Arab countries?
Okay, so to answer the second question, how do we manage and organize these activities? Basically, there's three main things that three main entities that we do. So first, we have the Secretariat of the network, which is based in Lebanon, but we coordinate with everyone. We have a full team. We have our coordinator, our assistant coordinator, our team, all of our team. And the team, the Secretariat, really organizes everything. The second thing is that we have a primary investigator who is a regional primary investigator who will actually set the skeleton to make sure that we're all the national primary investigator, which is the third thing that we do, will be working in harmony and will be able to produce similar types of findings and results in the same way. So we have these three different entities that are very important for us to coordinate. And we also have regular meetings. We have workshops in order to brainstorm how we want the skeleton of the findings or the policy brief or the report to be. So this is how we coordinate the work. Concerning the second question, which I believe Lucy copied from the chat, how do we make sure that the communities are heard? The first thing is when we are choosing, and this comes in the choosing the topic, when we're choosing the topic, we basically go and talk to local actors. We have based on the topic that we choose, we have a list of topics, and we send it out to local actors who are working with the community, and they can tell us directly the feedback that they are hearing and what is the priority that they are seeing we need to investigate at the moment. And this is also how the participatory happens. We really hear from them. And we also receive a lot of messages, and we receive a lot of emails. So we also try to take all of this into account. And our team is in various coordination committees. So we also are hearing and listening and trying to go to the field as much as possible to hear and make sure that their voices are heard.
Thank you. Thank you. Thank you, Grace. I hope this is satisfactory. Now, let's go back to the other. Here she is. I have to say, Kate has a long CV, and I will try my best to summarize it. Kate's research focuses on improving education and supporting the adults most critical to child development for children and youth growing up in disadvantaged circumstances. She received her doctorate from the New York University in psychology and social intervention programs, and a master's from the Harris School of Public Policy and University of Chicago. Prior to her graduate study, she worked in direct services with children and families in Boston area, San Francisco, San Diego, and Chile, and in New York University, New York City. Kate is currently a senior research scientist at the Global Ties for Children, which is a research center within the Institute of Human Development and Social Change that focuses on pre-primary and primary education in conflict-affected and low-income countries. Kate mainly worked there in collaboration with the International Rescue Committee and the Sesame Workshop, providing early childhood education support for 0 to 6 years, mainly to Syrian refugees, and also act as an internal point person for quantitative research design. The second presenter will be Lina Torosian. She is a senior research, monitoring, evaluation, accountability, and learning manager at the International Rescue Committee in Lebanon. This currently focuses on overseeing the research, monitoring, and evaluation of early childhood development programs at IRC in Lebanon. Prior to joining IRC, she was part of ample research and monitoring activities in the public health, child protection, and gender fields. She holds an MPH in public health, concentration, health, behavior, and education from the American University of Beirut. Please, Kate and Lina, please go ahead. It's yours.
Thank you, Dr. Ghassan. Hello, everyone. Today, we will be presenting a research that we recently concluded on the impact of short-term remote early childhood education program for hard-to-reach families in Lebanon. The research itself is based on evidence from an 11-week ECE program. Just before going into the research methodology and describing what we actually did, just to give everyone who don't know the Ahlan Samsam initiative a little bit of a background. So back in 2018, Sesame Workshop, along with IRC and New York University Global Ties, received one of the biggest investments from the MacArthur donor on carrying out an intervention for children in refugee settings. This was the first of its kind in the Middle East. Specifically, the initiative itself supports the critical early learning needs of children in 4 countries, including Lebanon, Jordan, Iraq, and Syria. And of course, I can go on and on about the program itself. However, just to give a quick overview, there are three major components in the program or the initiative. There's the mass media and distribution component, where there's a TV show. You probably have seen the TV show if you follow NBC3, and you can also see, of course, the content on YouTube, which is the Ahlan Simsim content. There's also the second component, which is related to ECD programs and services that are being implemented within each of the countries, either directly by IRC or with partners. And the third component is related to working on policy and practice. A lot of the research we carry out actually have built evidence in order to inform policy change or strengthen ECD service provision on the ground. In regards to the research that Kate will be discussing further in terms of findings in a little bit, just to give a quick background, in Lebanon specifically, we wanted to carry out research on the early childhood education program, specifically provided by IRC, which is the preschool healing classroom. It used to get carried out in person. However, as everyone was impacted, with the COVID-19 pandemic, we weren't able to carry these out. So we started thinking together with the partners on the initiative, what can be done if in-person classes are not viable, and what can be done specifically for highly mobile families. And how can we support caregivers, especially during settings such as COVID-19, where they are the ones who are directly interacting with the children, and there's no possibility for teachers to be directly involved in the teaching process. Accordingly, we created the impact evaluation design, which was to assess the impact of an 11-week remote early learning program alone, which we call the treatment arm. And then the early learning program coupled with a remote parenting support program, which we call Ahlan Simsim Families, and that was the treatment plus arm. And then we compared these two groups with a waitlist control group. The key outcomes for the research itself included child development, parenting stress, parenting self-efficacy, interactions with the children, caregivers' belief about play and social emotional learning, and then caregivers' anxiety and depression. Just so before we go into the findings, for anyone interested to know each of the programs, the remote early learning program specifically was made up of providing each of the families who joined the groups a home kit with the necessary materials for the child to be able to carry out all the required activities. Teachers actually delivered the ECE content through caregivers over WhatsApp. Each of the phone calls were around 35 to 40-minute group calls, and we had a total of 31 group calls over 11 weeks. The focus was to actually help the caregivers carry out the activities with their children in the home setting. And the activities included letters, colors, numbers, shapes, observation, social skills, and health. And then teachers provided one-on-one follow-up calls with caregivers as needed. In terms of the Ahlan Simsim Families content related to the parenting program, the program itself is designed to support caregivers who take care of children 0 to 8 years old, to build their knowledge and skills in positive parenting, mental well-being, child protection, and early learning practices. This is where ECD facilitators, again, provided to the caregivers in a group setting over WhatsApp, over the 11 weeks, 25 to 30-minute phone calls per week. And of course, the content that was shared were all supported by media content that was designed by Sesame Workshop. So across the 31 phone calls and the remote early learning program, families received 43 videos, 8 read-aloud storybooks, and 7 songs. And then across the Ahlan Simsim family sessions that were spanned over the 11 weeks, caregivers received 15 videos, 6 booklets, and 1 poster.
Great,
Like
thank you, Lena. Oh, sorry, I thought this was where we were switching.
Go ahead, please.
But Tina, I saw your hand's been up for a while. Do you want to ask a clarifying question before we jump into the research design? How did you choose the families? I'll get into that a little bit on this next slide. Yep. Okay, so we had, as Lena mentioned, we had a study design that was a waitlist control design with 3 treatment arms. And so the first treatment arm received the remote early learning program only. The second treatment arm received the remote early learning program along with all on Simpson families. Both of those programs ran from March to June of 2022. Then we had inline data collection, and then the waitlist control program group received the program from July to September of 2022. So everyone did receive the remote early learning program. Our sample is 1,606 children and their families, equally split between boys and girls. And the caregiver, to get to the point of how we chose the families. So 93% of our families have no prior early childhood education experience. That was not an eligibility requirement for being in the program, but it was very purposeful. So Lena mentioned that this came out of this came out of adaptations during COVID, but we really wanted the research to inform beyond the COVID-19 experience. And so we wanted to say, how well does this program that was developed due to COVID work in settings that we already know we're having trouble getting in-person ECE access to for various reasons, either because of the mobility of the families or because it's not safe for teachers and students to get to schools, or because there's not the resources to build an in-person school or infrastructure. Grace mentioned some of those challenges. And so we wanted to say, how does this work in places where we know we're having trouble getting in-person ECE access? And those were the locations that we targeted. And then we recruited families to sign up for the program. So that's how we selected the families. And sure enough, 93% of which have no prior early childhood education experience. The majority are Syrian refugee families. Again, not an eligibility requirement, but that's who's having the most difficulty accessing ECE where we were working. 4% are Lebanese host community families. And unsurprisingly, given the multitude of crises that Lebanon's been experiencing lately, these are families that largely are struggling when it comes to basic needs and resources and like financial stability. One other thing to note on this slide is that we have a caregiver survey at baseline and inline. 22% of the caregivers are not the same caregivers in those two in baseline and inline. So like a mother answered at baseline and a father answered at inline. This was not what we were expecting when we first went into this. This was not our what we were expecting when we first did this. We were kind of thinking of this as a caregiver child dyad for the remote early learning program in particular. But it actually is what we're hearing in the qualitative research, which is that families see this as kind of a whole family's job to make sure that this child is able to participate in school and able to do these activities. And whoever is free that day, make sure that they do the activities with the child or join a call with the child. And so they don't actually see it as like a dyad. So this does make sense in terms of what we're finding. Looking at the data collection, we have a wealth of data in the study. It's really actually quite amazing. So today we're focusing on impact evaluation findings from the caregiver survey, which is baseline and inline, and the direct child assessment, which is baseline and inline. And I'll talk about more in a second. But just in case people want to follow up with other questions, we have interviews with all of the teachers, all the ECD facilitators, a sample of caregivers, including a select sample of caregivers who had lower attendance levels to understand their barriers to engagement. We've interviewed program staff to inform how this could be replicated in other settings. We have focus groups where we went back to caregivers and teachers and told them our findings and got their reactions to it. We have teacher surveys, attendance data, like there's a wealth of data in the study, which is really exciting. I'm not going to go through item measure by measure just because of time today, but we did one thing worth pointing out. One thing worth pointing out is that we measured the IDELA direct child assessment remotely, which is a real innovation to how that's measured. So for everyone who's heard of it, the IDELA is a play-based, usually in-person tool where an enumerator sits down with a child and they do various activities and the child gets scored and they kind of feel like games. So the IRC team adapted this to be done over WhatsApp video chat with the caregiver's help directing the video camera, which again, we've given entire presentations just on this topic, but I'm happy to answer more questions around it. But that was a real adaptation for this study. Okay, data analysis. We had an amazing team on the ground that actually we have very little missing data, especially for anyone familiar with the level of missing data we generally expect in working in crisis and conflict affected settings. But what we did have, we imputed using multiple imputation, and all the findings are pooled across 100 imputed data sets. We also ran a model that allows for the fact that we have different clustering in the 3 arms. So our control families are not in the program yet, and they're just individual families. Whereas our treatment arm families are nested within groups of 5 to 6 caregivers with 1 teacher, and the teacher runs 10 to 12 families. And then there's also a whole extra level for the remote early learning program plus Allen Simpson families where we have ECD facilitators. So we allowed our model to say we're going to have these different levels of clustering depending on the treatment arm. And then we controlled for a wide range of covariates at the child, caregiver, and household level, as well as if, as I mentioned, if that caregiver is different from baseline to inline, if they had a change in teacher during the course of the program. I know it's only an 11-week program, but there were some human resources delays where a few teachers weren't quite able to start when the program started. So other teachers filled those classes and then they started a few days or a week or 2 later. And also we controlled for what we're considering like a proxy for the harshness of the enumerator in assessing the direct child assessment at inline. Okay, findings. Just a quick flag about the findings that I think is actually really exciting. So it looks like a footnote, but it's exciting. None of our results that I'm presenting today were found to differ by any moderators that we tested. So they don't differ by caregiver education and literacy, by socioeconomic status, by household type, by the baseline level of the outcome. So if it's caregiver, if it's if it's motor skills, they don't differ by the motor skills that the child started with, or child gender. This is particularly exciting for caregiver education and literacy because I think there's a really strong belief by a lot of people within early childhood education that not only can you not do it remotely with little kids because they're too young and they can't engage in remote settings, but also that you can't do it in a way that utilizes caregivers because it will just increase inequity because caregivers with high education levels will do it well and caregivers with low education levels will do it poorly. And that is not what we're finding. We have the same effect size regardless of the caregiver's educational background. And that's particularly exciting because our effect sizes are really exciting. So we found really large improvements in all domains of child development from the remote early learning program. These effect sizes are, the motor skills one's a little lower, but in general, they're in the range of like 0.4 to 0.5 effect sizes, which if you follow the research is very, very comparable with other programs comparing preschool to no preschool, including programs that are full year programs or full day programs. And of course, this is an 11-week remote program. So this is incredibly exciting. You might notice that the lighter orange bars are not as tall here. So we did find smaller effect sizes for the treatment group that received both remote early learning program and Allen Simpson families. And in some cases, like social emotional skills and motor skills, those effects are no longer significantly different from the control group. I will note they're also not significantly different from the group receiving only remote early learning program. So they're kind of like right in the middle. But the pattern is that we're seeing larger effects and more robust effects for the group that only received the remote early learning program. And this pattern holds on the next slide when we look at the learning interactions, the caregiver reported learning interactions being done in the home with the child. Also large effect sizes, also a little bit larger for the group only receiving the remote early learning program. We do not see effects on other parenting outcomes or on caregiver well-being. Just on child development. And so I'm very aware of time. So conclusions. Our conclusions are that a thoughtfully implemented remote early learning program can work. And indeed, it looks like it can work the way we talk about preschool working in general, which is really exciting for spaces that we're going to have trouble putting in an in-person preschool for a multitude of reasons, as we've discussed. We don't see any evidence that adding this parenting support program in this case helps with those effects. In fact, it may reduce them. Although we did see some evidence that I didn't have time to go into today, but can answer that the Allen Simpson Families program did reduce caregivers' report of spanking their child, both in the qualitative in our qualitative work and in our quantitative work. And our impacts are high across caregiver education and literacy levels. And we think this has really, really huge potential in humanitarian hard to access contexts. And I'd also add that I think it presents a real opportunity for working with caregivers and in terms of the transition to primary school generally. We all know that caregiver engagement and getting caregivers to engage in primary school is a challenge kind of around the world. And while we can't test it here because our control group has already received the treatment, I think this is something I'd like to test moving forward, is does a program like this change caregivers' engagement throughout the child's schooling and not just in the early childhood years? Thank you very much. And we have some references, but also a slide with our emails, and I can put those in the chat as well for any questions. Sorry that I was trying to get through a lot of information in a short time.
Thank you. Thank you so much, Lina and Kate. We have a few questions for you. First, there is the question of how did you choose the families? Second, did you have any experience with the disability, with children with disabilities? Because it was a problem for Dr. Musa Sharafuddin, who works with disabilities in children during the COVID. And the third question is, what research tools did you find to be most effective when working with young children? And for Grace, how did these tools develop through a participatory approach? So let's start with, how do you choose the families and disabilities?
Lena, do you want to take those?
Yes, for Kate and Lena.
Sure.
And
Yeah,
Lena.
sure. So we wanted to make sure, even before we transitioned to carrying out the research remotely, we wanted to make sure that we are going into areas where no one is actually working on ECE specifically. So the areas we went to were very rural in nature, where no one has ever gone before, no one has ever provided education services before. And that's why you actually saw in the data that almost the majority of our children do not have any prior experience in early childhood education. Unfortunately, in relation to disabilities, that's not a focus that we had in the research per se, neither in the sample. So we have very few percentage of children who had some form of disability. However, unfortunately, we didn't explore enough, or we didn't address the topic of disability enough to be able to comment more about this.
We did have some qualitative, just anecdotal stories where in some of the focus groups, caregivers would say, this program works particularly well for my son because he would struggle to get to an in-person school because of, and they would like list a disability. But again, these are a handful of stories, we don't have the numbers to test anything around the disabilities.
Yeah.
And about disabilities?
Yes, so we couldn't comment much about how we can address children with disabilities through the research that we carried out.
Okay, thank you.
And Suzanne actually is mentioning that there is a character under Ahlan Simsim who has a disability. It wasn't a character we used in the content as well that was generated during the time we carried out the research, unfortunately.
I'm also seeing a question around internet access and electricity stuff, and that, yes. So we have an entire qualitative paper coming out on our qualitative findings, and one of the big things that comes out of that is that really was a struggle. But what also comes out around it is that it was a struggle that the teachers and caregivers really went to like Herculean efforts to address. So we have caregivers talking about going to the roof to get service, or charging their phone at the neighbors because they didn't have electricity and the neighbor had a generator, or like they really worked, like this program was extremely important to everyone involved, and they really worked to address those. And we're also brainstorming ways that future iterations could like provide even more support towards addressing those issues. Yeah,
I think this is very important. I think connectivity is a problem in this case, and sometimes we have incentives to make them to get them charging their smartphones to follow up even.
We did provide recharge cards for
Okay.
for data
Okay.
service to all families.
Okay. We have still 2 questions yet. Grace, please, about what tools do you develop through participatory approach from
Yes.
Sophia?
So for the tools that we were developing, we basically tried to search for what there were tools that were already validated and scientifically tested so we can use. And then we took them and we tried to contextualize them. And when it comes to the participatory, here we also had several meetings with our primary investigators in each country, and we tried to prioritize the subscales that were the most important, or if there were priority topics that were not already covered by the scale that we were choosing, we highlighted it and then we developed it together. So the Secretariat was the regional primary investigator was leading this development, and then all the surveys were sent to the national primary investigators. So for example, the recent one, the Strategic Research Model 2 on the working conditions, although it is one questionnaire, we have 7 versions of it because the terminology is different in each country, and we want it to be as true to the context as possible. So we have one questionnaire, but 7 formats of it to make sure to be able to get the most accurate answers.
Thank you, Grace. The last 2 questions I would say from Sophia for Kate and Nina. Were you able to identify if in your research, what aspects of the program design contributed to such large improvement? What were that can be applied when designing these sorts of interventions?
We think there were a few key things. So for one, we think it was really critical that this was framed by IRC very clearly as school. It was being done remotely, but it wasn't framed as a different type of service or a parenting. It was framed as school. And they took that very seriously. When we talked in our interviews and everyone talks about, oh, my kid has school. We want to make sure that they can do all their schoolwork. They sometimes wanted this stuff in the morning so that they could get up and go to school. So that I think was really important. And indeed, they also had an element where the caregivers were asked to send in pictures and videos of doing the activities with their child. So there was a almost homework element to it, and caregivers got really into that. So I think that was a really big part of it. And I also relatedly just think there's an intense amount of caregiver commitment to and teacher commitment to this program. Though on the teacher front, it's interesting. A lot of the teachers told us at the beginning that they were like, we didn't think this would work. You can't do remote school for 5-year-olds. They're too young. Great, thanks for giving me a job. This isn't going to work. And then a few weeks in, they were like, it's working. I'm so proud of myself. So that was exciting. But we do think that was a big part, just the immense amount of commitment. And then the last thing I would ask is that it really was focused on what we know works about ECE. So rather than trying to replicate the in-person classroom, which I think is hard to do over WhatsApp or Zoom, we were really trying to replicate the activities and the engaged child engagement that we know is the most important at this age. And I think that was done very successfully by the program team.
Thank you. One last question. You mentioned Syria being a country of focus. Were you able to reach youngest children affected in all of Syria or only north of Syria?
We didn't reach Syria as a country. The research itself was implemented in Lebanon. It just so happened that the areas we went to where there were no ECE services, the majority of the children who were out of school were of Syrian nationality.
Thank you. Thank you so much, everybody, and thanks for the presenters. I give back to John to continue the agenda, please.
Thank you, Ghassan. And I just want to mention before we talk about the research fellowship, how groundbreaking what you all heard is. The strategic research model that they're developing in the region can be replicated in other regions. I think that, Grace, you're going to have a lot of lessons to share about the process as you move forward. And we're really excited. One of the goals of the research forum is to localize research, to bring it down, and you are the exemplar of that. To the IRC Global Ties and Sesame group, I remember when it was announced, the MacArthur Grant, it was groundbreaking, and your findings will, I think, continue to be discussed as we move forward. We need you to keep sending those findings out, put them in sound bites so we could use them. Go back and think about children with disabilities. We need more focus on that, and adaptation, so we are supporting parents in a more holistic way. But thank you to the whole entire team for your groundbreaking research during COVID, which was amazing in the way you adapted it. So let me briefly, because we're almost out of time, tell you about the research fellows. In December of 22, the Research Forum put out a call for applications to support local researchers in the Global South to carry out research related to young children and their caregivers in emergencies. The requirements were that you were born or living in a country affected by crisis, and you had deep connections with communities and local organizations serving young children. The fellowship was meant to support 6 fellows with $5,000 stipends, and to run from May 23, this month, through May 24. We were just overwhelmed with the response to the fellowship. We received 112 applications from 35 countries. People could apply in English, French, Spanish, and Arabic, and we had a mixture, although there were predominantly the applications came in English. We had reviewers that spoke all of those languages, and a special shout out to the Unbounded team for their amazing work to go through these. One of the things that I want to stress here is that any of the 112 applications could have been a winner. They are winners. And if you read through them, through many of them, and we're thinking about how we group them, how we involved everyone, they really are a picture of the urgency of this issue, what children are going through. Grace mentioned right from the beginning, they need us, they need us. It was also a picture of people who were bearing witness to what children were going through and documenting it, and trying new methods to reach children and families. So these applications are a testimonial to the work that's going on around the world. I want to announce our 6 winners. We are absolutely delighted with this group. From Nigeria, from Kenya, from Uganda, from Palestine, from Bangladesh, from Brazil. They represent all of the hotspots and places around the world where children and families are struggling, and researchers are trying to document their needs. You will be hearing more about their research in the upcoming year, but we are just so proud, not just of these 6 wonderful people, researchers, but to all 112 people that applied. We'll try to lift up your work in new ways across the upcoming year. I want to just end with the following slide. We hope you sign up for the research forum. We are really excited that we pull this off, that we actually have a forum, a monthly research roundup, so that these publications are not going on shelves and in academic journals only, but they're being put to use. We hope you provide us information about your own research so that we can document that. And if you have not signed up for the research roundtable, we urge you to do that. And then finally, We will be having our next webinar. As you can see, we're trying to move the webinars around the world and focus on different regions. It was really terrific to hear all the work that's going on in the Arab region. We will do our next webinar on July 18th, which will be focused on the Latin American region. We're very excited about the research that's coming out there, and the steering committee and the members of the research forum are helping to plan that. So if you have ideas for that, please let us know. So with that, I want to thank all of the amazing speakers. I want to thank Dr. Ghassan and all of the people that put this webinar together. Stay tuned and stay with us. Thank you.